All right, warriors, last lesson, best lesson. Up to this point, we've really been focusing on the different approaches to therapy, and here we're going to get into biological therapies. Biological therapies rely on medications, on electric shock, and even surgery to help people modify their behavior. All these biological modifications and methods help affect the brain in some sort of way. And because these treatments are medical in nature, they must be administered and prescribed by a medical doctor, a psychiatrist, or a physician. Psychologists do not prescribe drugs or administer biological treatments, but they may help determine whether or not it's necessary. Using this biological approach, we will take a closer look at psychosurgery, electroconvulsive therapy, and drug therapy. Let's go. We start with psychosurgery, and the best known psychosurgery was a prefrontal lobotomy. That was used in the 1930s and the 1940s, and it's really kind of an ugly process that was over in about 10 minutes. What happened, it was developed by a man named Moniz, Edgar Moniz, and he would sever the frontal lobe connections by using an ice pick through the eye socket. Extreme measures. Did it work? Yeah, it worked to subdue a patient, to make them more manageable. But unfortunately, because when we shove the ice pick in the eye socket, we don't really know what the results are going to be. And so the side effects can be as ugly as someone being completely comatose, no longer responsive. Desperate measures. The lobotomies were popularized, like I said, in the 1930s, and they were kind of in favor for a long time, until finally they stopped being in favor for good reason, because people were out of it after a lobotomy. All right, next is electroconvulsive therapy. And imagine that a person goes in for a treatment, and what happens is they get knocked out, and then an electrical current gets passed through the brain. This causes seizures and convulsions. It was used again in the 1930s for disorders like schizophrenia. But then when we got new antipsychotic drug treatments, it's gone away. It is still used for depression, and that's in extreme cases of depression and major depressive disorder when other medications don't work. So does it work? Well, yeah, it works for major depression, and we really don't know how or why. It can have temporary confusion and memory loss as a result. Not in here, but related, is magnetic cranial therapy. That's something that also manipulates the electrical currents. It might be a little less dramatic than something like electroconvulsive therapy. That brings us to drug therapy, and drug therapy is the most widely used biomedical therapy for disorders. And since the 1950s, discoveries in psychopharmacological exploits research have revolutionized the treatment of people with severe disorders. Drug therapies have helped the residents of the population in the U.S. It helps people in mental hospitals, and it drops people who suffer from disorders to a fraction of what it is and what it used to be. Common drug treatments include anti-anxiety medications, antidepressants, antipsychotics, and mood stabilizing drugs. So those are the ones that we'll talk about. First, anti-anxiety. They slow down the nervous system. They're used with talk therapy, with psychotherapy. Prolonged use of anti-anxiety medication can lead to them being less effective, so it might have to be manipulated. So some ones that people may be prescribed: Xanax, Valium, Ativan. All of these are prescribed for anxiety-related disorders. We don't want to think that this disorders are something we can throw a pill at and be done with it. No, it also has to come with other sorts of therapy, with the talk therapy, cognitive behavioral therapy. Antidepressants are also known as SSRIs, and that stands for selective serotonin reuptake inhibitors, because serotonin is what helps us feel okay. Well, it helps us to feel good. And some of those drugs include Zoloft, Paxil, Prozac. May not help severe depression, and it does have significant side effects. But antidepressants are effective for anxiety disorders, OCD, and people who are severely depressed. It can work in reverse, actually. So those have to be very carefully watched and regulated. All right, antipsychotics, also known as neuroleptics, work to prevent psychosis. People with schizophrenia are likely to be prescribed antipsychotics because they're effective in reducing agitation, delusions, and hallucinations, and they've helped people with schizophrenia live almost normal lives and outside of mental hospitals, hold down jobs, live effectively with the things that they have. Schizophrenia is associated with high levels of dopamine, and antipsychotic medications are thought to work by blocking the activity of dopamine in the brain. Unfortunately, prolonged use of antipsychotics can come along with a loss of balance or difficulty with balance and coordination, and can produce tremors and twitches, and these have their own side effects that we'll not talk about in this one. Thorazine is one of those drugs, treats mental disorders, severe behaviors, severe hiccups, severe nausea, vomiting, certain stuff. Also used after surgery to relieve anxiety. Antipsychotics are useful for those who are suffering from these delusions, hallucinations, and help them to live almost normal lives. If they go off the medication, delusions, hallucinations may come back, and then the patient may relapse. Mood stabilizing drugs are going to be used for things like major depression, bipolar. One mood stabilizer is lithium, which is simple salt. Effectively levels the emotions, the highs and the lows of bipolar. We don't know exactly how it works, but it works in 7 out of 10 people, and they benefit from taking lithium. Lithium's effects may have been one of the reasons why it was included in the ingredients in 7-Up. The drink contained lithium citrate and started selling just 2 weeks before the stock market crash in October of 1929, kicking off the Great Depression. And theories about the origin of the name vary. The most logical explanation is that the 7 in the name refers to the drink's 7 ingredients, and these included carbonated water, sugar, citrus oil, citric acid, sodium citrate, and lithium citrate. So the up references the lithium lift. That's been banned, so the U.S. Food and Drug Administration banned the use of lithium in beer and in soft drinks in 1948, and 7-Up's been reformulated. Now, you know I'm not a doctor of psychology, but this is one that I would back 100% because it has helped treat my anxiety and depression and things, and that is a therapeutic lifestyle change. Clinical psychologists will fall back on these things and noted that the human brain and bodies were made for physical activity and social engagement. And so our ancestors hunted, they gathered, and they built in groups. And I'll bet they weren't going to Alcoholics Anonymous meetings. People today whose lifestyles include strenuous physical activity, strong community ties, sunlight exposure, and plenty of sleep rarely experience depression. Research with foraging people in Papua New Guinea, Amish farming communities in North America have shown this too because they're working a lot. Exercise reduces anxiety and depression. It helps children do better in schools. It helps improve our cognitive performance. And in adults, it reduces aging-related memory loss in the elderly and increased new neuron formation in the brain. Exercise, check. Diets rich in vegetables, fruits, and fish may help students perform well in schools, maintain cognitive functions in adults, as well as reduce symptoms effective in schizophrenic disorders. Spending time in nature can improve cognitive functions and overall well-being. Good relationships can reduce healthy risks, ranging from the common cold to strokes, as well as multiple mental illness. It can enhance psychological well-being dramatically. Recreation and fun can reduce defensiveness and foster social skills. Relaxation and stress management can treat a variety of anxiety, insomnia, panic disorders. Listen, meditation has many benefits, can improve empathy, sensitivity, emotional stability, reduce stress and burnout, enhance cognitive function, and even brain size. And lastly, a religious or spiritual community involvement that focuses on love and forgiveness can reduce anxiety, depression, substance abuse, and foster well-being. In this chart, you see that clinical status at 10 months, that is 6 months after treatment, among patients who were remitted after 4 months of treatment in exercise medication and combination groups, compared with participants in other conditions. Those in exercise condition were more likely to partially or fully recover and were less likely to have relapsed. So the moral of the story is medication can help you. All those other things can help you, but if you live a healthy lifestyle, that's going to put you on an even better path. But you already know this because you're bang up psychology students and you're exercising and getting plenty of sleep and all the things. Now, I know from my own experience that that's one of the things that work. And it's one of the reasons why I do all the things that I do. All right. Hey, that's all for therapy. That's your last lesson. So I wish you well, and I hope that you walk away from this unit knowing more than you did before.